Hello, everyone. Good afternoon. This is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan, and also Los Angeles, California. A warm welcome to the many listeners and the viewers who are joining us. This is officially our very first recording in the new studio, and a pleasure and a warm welcome to each and every one of you. Hopefully, over the next several sessions and screenings, you will be able to get good insight as to what it means to have breast implants. If you're considering them, what exactly it is that you will be signing up for, the true informed consent. We want to be able to educate you and have you understand what exactly breast implants, silicone implants, saline implants are all about. If you run into problems, what to expect, what we know from the literature, what we know from the FDA warnings, what we know from the manufacturer's warnings and studies, and ultimately, most importantly, what we are hearing repeatedly from the many patients who are hurting and who are now making that executive decision in regards to getting the implants removed. Now, I want to go ahead and start off by mentioning and saying that the only disclosure that I have is that I am fully 100% faithfully committed into helping the patients. There is no financial disclosures that I have. There is no commitments with any Facebook groups, any manufacturers, any supplemental agencies or anything like that. My only commitment is to the patient. And ultimately, this is where I'm fulfilling the oath that I took, that do no harm. Basically, the patients need to understand what it means as they sign up with me, as they understand. As you will see, this is a lot of objective evidence. This is not my opinion. This is hard facts that we know of that already exist. And as you will see, we're going to be going into a lot of details where we know a lot of information. Remember, the breast implants were once banned in 1992, and all the way in the latter part of 2006, they were reintroduced into the market. So having said this, I will get started. Let's go ahead and start off by talking about what is the FDA black box or black warning that they have put forth. And if you look at the white journal that we read, and you can certainly Google this, you will see on the back of it, this box, it will tell you and it will highlight the first and foremost important thing, and I'm going to read verbatim: the breast implants are not considered lifetime devices, quote unquote. Now, just talking about this, you will see that if someone gets implants at age 22, for example, they will, plus minus 10 years, they will need to replace them, which means that when they're 32, plus minus 42, plus minus 52, they will have to replace them, remove them, and they're not lifetime devices. And going on to the second part of the warning, quote, the longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery, close quotes. And the point here is that if you have them for a longer period of time, you will run into problems like malposition, capsular contracture, rupture. In very rare cases, what is the second point, the lymphoma that they're talking about. And so one needs to understand that if you are considering getting breast implants, or if you have breast implants and you're having problems, this is totally not unexpected. This is essentially what is the expected course of these breast implants. Now, the second part of the warning that they mention, and I will again objectively read, which has been very well established, quote, breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants. Although rates are not well defined, some patients have died from BIA-ALCL. Now, this is the lymphoma that we have heard of associated with the textured implants. And so as you will see, if you read the writing carefully, smooth implants have also been implicated in the development of this very rare BIA-ALCL. So there are smooth implants that cause this rare cancer. Now, there are other cancers such as the BIA, breast implant associated, SCC, squamous cell cancer, that has been reported by the FDA that is associated with implants. And the whole point here is not only textured but smooth implants, and not only smooth silicone but smooth saline implants as well. So you have this very real direct association between the implant and the cancer that is very much established. And so there is no denying the fact that there is a association between the two. So that means if the patient did not have implants, they would not have gotten this lymphoma. Now, one thing I want to mention here is there are some two hard facts associated with the implants. Number one, this lymphoma is very much underreported because not many surgeons are removing the capsule, or they're considering or thinking about this rare lymphoma. Even when they're removing the implants, they're not removing the capsule. When they're not removing the capsule or checking for it, they may be sending the capsule off to pathology, but they're not doing the CD30 analysis. And because that is not being done on a regular, repeated basis, this cancer, this lymphoma, is being underdiagnosed. And this is very well established by the plastic surgery societies and the plastic surgeons all over the world. To date, there have been only approximately 1,250 cases reported. But we all know for a fact, and we have already reached a consensus, that this is underreported for the many reasons that not many surgeons are removing the capsule, and not many of those capsules are sent to pathology, are being tested for the CD30 analysis. And there have been other associations with other type of lymphomas and cancers with implants that have yet to be determined, and this is also established. So this is, again, very important for the patients to note. We heard another surgeon earlier this month who said that smooth implants are not implicated in BIA-ALCL, which is absolutely incorrect information. Smooth silicone and smooth saline implants are also implicated in the BIA-ALCL. So this is, again, as I read out to you, again, not my opinion, this is objective evidence. And the third thing that I want to highlight here is, and again, I quote, again, this is not my opinion, this is objective, hard evidence that we know is very well established and remains undisputed. You have the third point that the black box warning highlights, quote, patients receiving breast implants have reported a variety of systemic symptoms such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. So just right off the bat, this is what is breast implant illness. There are a lot of surgeons who claim breast implant illness does not exist. Well, guess what? This third item on this black box warning definitely declares clearly that breast implant illness does exist. And so continuing on with this black box warning, quote, individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. So complete resolution means cure. So these patients who remove their implants and do not replace them, they have complete resolution of what they're saying clearly, autoimmune problems, joint pain, and others. Others means the many other symptoms that the patients come in with. For example, the most common symptom being fatigue, dry eyes, hair loss, migraines, ringing in the ears, and this is, again, going top down, neck, back pain, shoulder issues, fibromyalgia type issues, connective tissue disorders. The hallmark feature of breast implant illness are the rheumatological joint problems, the palpitations that the patients have, young and old, breathing problems, neck, back pain issues, like I mentioned earlier, GI disturbances. Patients have difficulty with their endocrine system, autoimmune problems, for example, that surface. Just like this warning said, you have patients with other problems such as plantar fasciitis, the UTIs or interstitial cystitis, amongst with almost all the organ systems being affected. And majority of the patients, they will be doing well till small problems start arising. And then slowly they will add up. Some problems might come and go. Some problems might linger on. Some problems might be episodic. And the point here is there will eventually come a time where the patients might start feeling the hurt and harm. And this might be attributed to perimenopausal time or postmenopausal or old age or the patient's underlying, for example, rheumatoid arthritis that may be the culprit behind it, but it might truly indeed be what is breast implant illness. Now, this is where, as you will see, that third point highlights fact number one, that breast implant illness is very much real and established, and we know this. Number two, that there is a potential cure for it, complete resolution, that's what I read. And number three, that there is a process of elimination, meaning as a patient, you need to go to your doctor and you need to rule out that you don't have a heart arrhythmia and that your doctor has done the Holter monitor, echo, or you have been appropriately worked up by the cardiologist. And you will see if you have an underlying problem, for example, joint pain, and you go to the rheumatologist and they say, well, you do not have rheumatoid arthritis. Once all of those pertinent negatives have been ruled out, then we have more and more fingers pointing towards what is breast implant illness. Because what's interesting and unique about this illness is that it is a very mysterious illness. It's a very evil illness in the sense that there is no lab test and there is no imaging test that tells us if a person has breast implant illness or not. And this is where it's a diagnosis of exclusion, which means once all those other diseases are ruled out, that means that it is, by process of elimination, breast implant illness till proven otherwise. And the one and the ultimate and only way to definitively, convincingly identify that this was indeed breast implant illness is when the surgery is done right, comprehensively, in a very detailed way, and then the post-op, the patient recovers, then they can pinpoint with accuracy that indeed it was the implants that was causing the hurt and harm, because now that the implants have been removed. And this is where you will see this, quote, revolution that's occurring not only in the United States, but all over the world. The patients are slowly realizing it was indeed their implants that was causing the hurt and the harm.